name is Kimo Gessner, and I'm doing my presentation 3 on weighing autonomy. To start off with an outline, I have the introduction to the exposition, moving forward into the critical evaluation, and there folding in my conclusion and my references. For the introduction, I wanted to add some information to start us off with. Assume you're a doctor in California and take care of many patients in your hospital. One patient comes in with a noticeable sized mass in their chest that may be a fatal form of cancer. Though the family is also present in another room, you personally want to let them know about the situation and steps moving forward. However, that is not your call to make in sharing a patient's medical status as they refuse. Some questions about this scenario would be, should the doctor speak out regardless? Is the doctor wrong to go beyond the patient's say-so? What is morally right and wrong in this scenario? And how does one determine autonomy or competence? Moving forward into the exposition, we can start with the doctor's appeal on how the patient may need immediate attention and go straight to surgery. Again, it is fatal, as the doctor suspects, and they don't want to take any risk. The family should understand what is at stake, so not only does the patient and the doctor know, but the doctor feels like maybe everyone should know, just so we can get a grip of what's going on. And lastly, you should be in the best interest on all ends to save a life now while it can be done safely for the best chances of survival. On the other side, the patient's appeal may be, I'd rather leave the mass alone until I see fit, so maybe they don't think it's fatal and they just want to continue living life as is. I don't want to scare my family into thinking it is more than what is shown, so maybe they, again, don't think it is serious, and they don't want to share that with the family. It is ultimately my option to share my medical status or move forward with any procedures to begin with, so maybe even if they did let the families know, they possibly don't want medical attention regardless. And then revealing my autonomy goes against the confidentiality of the appointment. That's also according to the HIP AA privacy rule. However, I do have some personal thoughts moving on. I think the patient has the final say in what is shared with their family, as it is also their medical choice to proceed in any surgeries. The doctor may have his or her personal and professional concerns with the patient, as well as express those with them, but that does not give them the power to decide over the patient. That's also the U.S. Department of Health and Human Services I got a bit of that from. Moving forward to the critical evaluation of this argument, starting off, though the patient has received news that they may be in critical condition if they don't have a deeper look at what is the mass, the patient is entitled to share or keep secret of their medical whereabouts. No doctor is allowed to override that decision in this situation, since the patient clearly understands the circumstances. Again, it's his say-so, it's his option, it's his opinion, it's his right. However, on the counter argument of that, if the patient will not reveal the condition they are in, the doctor should bite the bullet to say it to the family. The patient may suffer major illness or even death if the mass is what the doctor may diagnose it as. The condition of the mass is timely and will lower the chances of survival if not addressed now. And the doctor should see this as a case to whistleblow because of the immediate harm the patient will put themselves in, knowing that the doctor has studied these cases before. But to rebuttal that, though the patient's autonomy is of primary concern, in this scenario, it is the right to privacy that must be obeyed no matter what. That's also from California Department of Justice. The confidentiality of the diagnosis does not cause harm/death to anyone outside of this case. The projection of the doctor's help cannot be questioned as well because the patient may have financial trouble or troubling relationship at home that is not necessary to share. So again, it is all up to the patient and their say-so. It is their right, even if it does end up being unhealthy and a possibly deadly option for them. In conclusion, the doctor should abide by the philosophy of right to privacy and keep their appointment confidential. In other words, the doctor must practice their own competency by staying silent and looking out for the patient's best interest, even if that means disregarding the critical condition the mass may take. And here are my references.